Okay, so the first test we're going to do is the valgus stress test. So I'm going to have the patient go to 0-degree angle, and I'm going to stabilize here, and I'm going to push in at the elbow. And you're testing the lateral collateral ligament and the ulnar collateral ligament for a sprain. And if the patient does have a sprain, they should feel pain, abnormal laxity, or an abnormal endpoint. And so we're also going to go at a 30-degree angle, and we're going to test it. And so the next test is the varus stress test. So we're going to go to 0-degree angle again, like this, palms up. And we're testing a sprain to the medial collateral ligament and the radial collateral ligament. And so we're going to go push out and pull in. And the patient should feel the same as the valgus if they do have a sprain, which is pain, abnormal endpoints, or abnormal laxity. And the next is the manual muscle test. So we're going to start with wrist flexion. And so for wrist flexion, you're going to start an extension like this and stabilize the forearm, and the patient's going to push up. Go, go, go. And don't let me push you down. And you're testing the flexor carpi radialis when you do this. And okay, so the next one is wrist extension. So you're going to start the patient in flexion, and they're going to push down. And don't push up. And this is testing the extensor carpi radialis, ulnaris. Sorry, ulnaris. And the next test is ulnar and radial deviation. So what we're going to do for ulnar deviation is you're going to start with radial deviation. So you're going to start like this, and you're going to go up and out against my resistance. And no, don't push you down. And this is testing the flexor carpi ulnaris. And so now we're going to do radial deviation. So you're going to start in ulnar deviation, which is the opposite, and you're going to go up and in against my resistance. Go. And so don't push you down. This is testing the extensor carpi radialis. And I would give him a 5 because he could go against my resistance and against gravity. And so the next test is opposition. So can you go like this, pointer finger to thumb? And don't let me pull. Go. Go. And this is testing the opponens pollicis. And then the last tests are forearm pronation and supination. And so I'm going to have you put your wrist like this again. And so for pronation, we're going to start in supination. And we're going to go in. So you're going to push against me in. Now don't let me push you down or back. And this is testing the pronator teres. And so now for supination, we're going to start in pronation, and you're going to push up. And don't push you. And this is testing the supinator. And I would give him a 5 because he could go against my resistance and against gravity.